Hello, everyone. Welcome to PermanenteDocs Chat. I'm your host, Alex McDonald. As you all know, I practice family and sports medicine here in Fontana, California. Although we're at the end of June, it is at the time of this recording, at least, it is still Pride Month, and we are joined by Dr. Pinera today from the Southeast Permanente Medical Group. So, welcome, Dr. Pinera.
Thank you. Can you hear me?
We can hear you. Yep.
Awesome.
The Dr. Pinera is the physician co-lead for equity, inclusion, and diversity in the Southeast Permanente Medical Group, and we'll be discussing how we can support our LGBTQ physicians as well as our LGBTQ patients and community. So, if you have questions, please feel, and you're listening live, please feel to drop them in the chat. We'll try to get to as many as we can. And so, we're going to jump right in here. So Dr. Pinera, tell us a little more about who you are and what you do.
Thank you so much, Alex, and thank you so much for having me here. Let's see, where do I begin? So my journey started in California, where I was born and raised, and then I eventually ended up here in Georgia at the TSPMG Medical Group, where I've been for the past 10 plus years, primary care physician in Midtown Atlanta, which is sort of like our West Hollywood downtown area. And I'm also the physician co-lead for EID, Equity, Inclusion, and Diversity. I've had that role for 8+ years. So been doing that work, seeing that work grow. And I'm actually second generation Kaiser Permanente employee. First doctor in the family, and both my parents are nurses, both retired. Now they're taking care of their grandbaby. But yeah, you can say KP runs through my blood.
Wonderful. Well, welcome to the chat. I'm really excited to have you. As I mentioned, June is Pride Month, and we're seeing celebrations and rainbow flags all around us. But tell us, what is Pride Month mean to you and to your community and to your patients?
You know, as I practiced and learned about myself and my journey, first being closeted and an out gay man since I was 18. Pride Month means to me a time for like acknowledgement, acceptance, and also recognition that we have a place and space in our community. And it's a very diverse community. I find that year after year, even decade after decade, the visibility of pride around the world and what it means to different people in different ways. Like for me, it means that, hey, you know, people are actually calling out Pride Month to me, knowing that I am gay, I am out. I have patients, even though I'm in the South, I have diverse patients, old, young, conservative, liberal, whatever, spectrum,
Right.
you know,
Yep.
all genders. Like they say, hey, like it's Pride Month, thank you. And we support you. And that means a lot to me, especially those who have yet to begin their journey as, you know, their full authentic self.
Yeah, I think it's so important to create a place and a space where people can be their authentic selves and feel supported, and they don't have to hide certain aspects of their personality. I have a rainbow sticker on my door tag, just to help give people some indications to safe place, and they can share, they can talk to me anytime they need something. And I think having the month of June be Pride Month really helps amplify that too, to help everyone understand the importance of making sure we all feel included, we all feel welcome, because so many people have not felt that way for so long.
True, very true. And I say that I wear my pride flag on me, put it up, because not to tell people who I sleep with, but to let the neighbors, especially gay neighbors with maybe a young kid who's also gay, like that's safe, you know, that I do this, I represent us, you know, to be visible, and that's safe to be yourself. So yeah. And yeah.
Wonderful. Well, that dovetails a little bit into my next question. And so, how you bring your own personal background to your professional work, as the co-physician lead for equity, inclusion, and diversity in Georgia Permanente. Tell us some about how you brought your own personal experience to that role, and also what your goals and initiatives are within the equity, inclusion, and diversity space within Permanente.
Thank you so much. That's a really great question, Alex. I bring my perspective as an outsider. And what do I mean by that? As I mentioned, I was born and raised in Southern California in the suburbs, where I felt like I was the only brown kid in the majority Caucasian
Mhm.
Like, well-to-do gated community. So that was one layer of otherness, and I carry that throughout my work. And I'll get to how I, practice with that lens.
Sure.
Then you add a different layer, of being gay and knowing or feeling what it is and hearing how it's not accepted, right? I was born in 1980. I am well aware of the AIDS quilt. I've lost godfathers to AIDS.
Mhm.
A lot of my parents' friends from nursing school died of AIDS. So, there was a stigma of being gay and
Mhm.
even being out, Um, so that being said, I've always, not always, but I know how it feels not to be fully accepted
Mhm.
or not fully appreciated or even attacked if you let your authentic true self come out, right?
Sure.
So with that lens and that experience, I made it my mission in every interaction I have, not even more than with friends, the community, family, but with the patients I interact with, I put myself in their shoes,
Mhm.
in terms of how can I help them understand that they can trust me, that I am not judging them. I'm actually listening to them so
Mhm.
I can provide equitable care in the way that will set themselves up for their best selves. So I feel like Permanente medicine sets me up really well in doing that. Yes, because of the affirming care education and the workflows and policies, but because like I'm given the time to do it and help understand all my patients.
Mhm.
Um, I say this because if I had someone like me as a kid that I can look up to,
Mhm.
I would have felt less alone,
Yep.
less isolated, and actually more self-actualized. But I'm quite happy with where I am right now.
That's so important, having role models that people can look up to and emulate, that look like you, that speak your language, that come from your culture. I think that's something that a lot of people underestimate or underappreciate, who are maybe not in the minority.
Mhm.
So tell us more about how your role as the physician co-lead for EID, and what are some of your goals and initiatives within that role specifically.
So you've probably heard of Belong KP Part 1 and 2, Mitigating Bias and Understanding Structural Racism. I have been in that early developmental steering committee for that, and then adjusting it according to clinicians' needs.
Mhm.
So that is an initiative that formally I'm a part of and have presented to our executive leadership team locally, but also in different regions. I've had the opportunity of presenting it to our board of directors. And I can say that I'm very proud that KP Georgia,
Mhm.
TSPNG, has maybe a 98, 99% completion rate for Belong to KP Part 1.
Wow, that's great.
And seriously, and it's because of the major support we get from our executive leadership team, namely NKIM, Dr. Chuck, our EMD at TSPNG. Shout out to NKIM. That being said, that's like one of many we have in the space of the buckets of care delivery, community, and workforce.
Mhm.
So another example is BRG recruitment. We're trying to increase recruitment of TSPNG or Permanente providers within our BRGs. We feel like it's a very good way of helping those who feel like other to be more engaged in the workforce. More belonging equals more performance, less burnout, you know? So I find that's a very good way of, joining a BRG. It's a great way of, getting connected, not just within the people, within the MOB, but also people in different functions throughout the organization.
And for those who are not familiar with all the different acronyms and the TLAs, the three-letter acronyms here at KP, can you tell us what BRG stands for?
So BRG is Business Resource Group, also known as affinity groups. For instance, KP Pride, shout out to our Pride members. Kappa, which is for African American. There's KP
Mhm.
Veterans,
Mhm.
and so forth. And KP Latino and KP Pacific Islander, KPAPIA. Capability too. That's our for those who try to support those with different abilities. And you don't have to be born into a group. You can be an ally, a friend, or a family member, a coworker to join. And I'm a part of all BRGs.
Wait, and I think that's such a great tool to help people cohort even within their clinic, within their MOB, or within their area, to feel like yes, you're all part of one KP and the KP family, and all part of Permanente Medicine, but also we can have each different groups experience the world in different ways, and having some camaraderie and having some a place to have those relationships and have those conversations, I think, is really critical as well. There's a lot more data coming out about almost like cohorting by race within business development and leadership development can be very valuable for some of these, particularly some of these groups who are in the minority when it comes to leadership and medicine in general. Sorry, I took you off topic. I apologize.
Oh no, you're preaching. I love it. It's I love it. You're preaching my speech. I love it. It's great.
So I apologize. I interrupted your train of thought.
No, it's fine. I totally agree with what you just said, and there's many upon many stuff we're working on. Another one is there's a Kaiser Permanente National Equity, Inclusion, and Diversity Conference every year. I'm biased, but I think we have the best conferences, especially before COVID. Oh my gosh, it was amazing. So I'm on the steering committee for that, and I'm trying to make sure that this year we get more CMEs for our providers who take the time to learn and listen, because I think that we deserve that as busy clinicians, because we're trying to enrich ourselves and learning about and providing culturally affirmative care, right? Affirming care. So I'm not fighting for that, but sponsoring that, asking for it in a way that's impactful for every Permanente provider.
And that's sorry, go ahead.
No, go ahead.
Well, I was going to say, and that dovetails, again, it's almost like you've read the script here. What are some of the major health concerns facing particularly the LGBTQ community that physicians and other clinicians need to be aware of, so we can provide more culturally appropriate care?
Yeah, I mean, great point, Alex. I was looking at some data locally, that's perhaps not even unique to Georgia. There's data that says that 1 in every individual who has HIV, 1 in every 5 individual with HIV does not know they have HIV in Georgia. Georgia was reported to be the number one state in the US for new HIV infections, with Atlanta being a hotspot. And it's not just, men who have sex with men, but it's also heterosexuals too, And Georgia ranks in the top 5 in the country for people living with HIV. The question is why? We can get into policy and access and all that, but it's all about education, reaching out to communities who need it. And that's what we're trying to do with our infectious disease team and community benefit partners. Getting our communities of color to understand what Truvada, what Descovy is to prevent HIV. And then some. There'll be a week where I would actually diagnose young men, like in their 20s, with HIV, maybe about 2 or 3 in 1 week. Not every week, but that's something like, wow. It's like, and that's been happening the past couple of years. I've been seeing an increase of that. But I do believe that KP, Georgia, has what it takes to address this in an impactful way, more so than the other health systems here, because of our integrated, culturally affirming, system. You know what I mean? Yeah. So,
and we know STD rates are on the rise across the country, not just HIV, but all STDs. And to your point before, you and I are of a certain generation where maybe we don't remember the kind of the heart of the AIDS epidemic in the 80s, but we understand that we sort of have some experience with that, and we know people who live through that very closely. Whereas today's youth in general don't really remember that, don't have that lived experience. And HIV and AIDS is now a chronic disease. It's not a death sentence like it was. And so I think a lot of people don't have the the fear, quite frankly, of and the wherewithal to use protection for not just HIV/AIDS but all STDs.
Yep.
And I think especially some of my younger patients here are just like, oh yeah, can I get tested again? Yep, can I get tested again? I'm like, well, can we talk about prevention? Can we talk about condom use? Can we talk about PrEP and other resources? So I think it's a bit of a cultural shift, and as physicians, I hope we can really sort of lead that charge and educate our patients regarding the importance of that. And obviously, prevention is worth a pound of cure, right?
It is. It is. And to that effect, it's nice to see that there are, injectable, PrEPs and all that coming down the pipeline. But yeah, I'm very proud of the work we're doing here locally. We have a very robust infectious disease team, very proactive and engaging our community. You mentioned, other STDs. Syphilis is on the rise. I have a really close friend who works in Permanente, Kaiser KP SoCal. That you guys are running out of bicillin, and
We are.
it's crazy, like syphilis was an oldie but a goodie, and it's coming back. But that being said, we have to be mindful of this, and all providers, not just LGBT providers, we need to be aware that that there are other areas that need to be swabbed, not just the standard STD panel, but you need to include the oral and rectal swab if necessary. And that is often forgotten, at least in my experience, when my gay patients go to other clinics. So that's one way, as providers to learn about and to be aware of.
Yeah. Can I ask you one question also, which I was just thought of, and I've actually asked this before. I have a relatively large percentage of gay patients, gay men, and is there any evidence for doing anal pap smears on a regular basis for patients who have anal intercourse, or is there any data yet? Because I think I last asked my colleague a couple of years ago, and he's like, I don't know, we don't really have any good data for it. Do you have any recommendations or any practice that you follow?
Refer to ID. No, I'm joking.
Please don't say that.
No, but seriously speaking, I've asked this question of my ID partner, and who happens to be in the same office. I love him, Dr. Katala. Shout out to him. This was some time ago, but I cannot speak to it like as an expert. But my understanding is it depends on your if you're immunocompromised or not. And then if you engage in if you're bottom, right, or burst. But that being said, this is something to your point about data. The problem is there's not enough data, and my observation is that we need to start using SOGI, which is sexual orientation and gender ID, with an EPIC. You're probably really familiar with that because of your cohort.
I am, yes.
Yeah, and by doing that, by gathering more data, we're able to identify our community so that we're not invisible, so that we do have the data to say, okay, anal pap smears, yes. So this is not unique to KP, but nation or worldwide. But it's upon us as providers to collect that data, so then we can go to our research department and say, hey, this is possible to gauge as to whether this is beneficial or not. Right.
Yeah. No, that's a great point, is identifying that cohort so that you can collect the data, so that then you can make some recommendations. Is one of the unique things we have here within KP. I'm very proud of that.
Right.
Well, my next question for you here, a little bit changing gears just a bit here, is the American Medical Association actually just elected their first openly gay physician as their president, Dr. Jesse Ehrenfield, who I've met many times. He's a wonderful, wonderful leader. Why do you think it's important for people who identify as LGBTQ to be in medicine, and particularly to take on these leadership roles? Is there something specific that you think is we need to continue to do, and what is the value of that?
Great question, Alex. And back to my point about representation and modeling. I mean, role models, seeing someone whom that shares the same journey, in this case being gay or part of the LGBTQ community, sort of puts into your mind that it is possible to live your full authentic life, be celebrated, but also promoted and become a leader, right? So that was something that was not missing in my life. I had my parents, they're awesome, amazing role models. I could say my awesome bed manners because of my mom, and my dad would agree. He's an awesome too. With that being said, if I had, seen someone that looked like me, knows my lived experience or can understand it, that would make it more possible for future leaders, for people who are, no matter what place or space, they can say, wow, I want to do that. It's possible. Let me do the work, right?
Mhm.
As opposed to just staying stagnant in the silo and not as productive for society. So I think it's very important to speak to your authentic life, much like the general public does in terms of talking about their spouses, their kids. We
Mhm.
should be able to speak to that, to our lives in an authentic manner. That's normative, that's just normal.
Yeah. Makes me think of the sort of the concept of being gay or lesbian or heterosexual is not who you are. It's part of a multitude of pieces that make up your being too. And
Mhm.
we can all be leaders, we can all be physicians, regardless of those other because of those other aspects of our lives as well too.
Yeah.
Wonderful. Okay, this is fantastic. We could go on and on, but we have to keep this short and high yield. We don't want to bore our listeners too much. Last
Oh
question.
no.
Tell me, no, I'm teasing. Tell me what makes you most proud to be a Permanente physician.
Wow. Well, first of all, I'm a lifer, okay? Uncle Kaiser's got me for life because um all the benefits, all of the, all that stuff. Like I feel like as a Permanente physician, I am able to practice my mission and vision as a doctor. Like take the time. Yes, we're busy. Yes, we're overloaded and stressed with a lot of patient work. But when I do make that connection and I'm able to influence my patient who's struggling with their A1C, get them from 13 to 6.5,
Mhm.
that's a win. Like it doesn't matter what's happening around the world. Like, empowering that person, that patient in a collaborative, trustworthy relationship, I mean, that makes me feel like, okay, Permanente is really helping me to do this, and it fills my cup every day. So with that, thank you so much for allowing me to be a part of this, and I look forward to watching more of your shows.
Well, thank you so much for joining us and sharing your expertise and your time with us today. We really appreciate it.
Pleasure.